My name is Dr. Meeraji Rao. I am a cardiologist with about 30 years of experience. Presently, I am the senior most doctor at Continental Institute of Cardiovascular Sciences, affiliated to Parkway, Singapore. And this is based in Hyderabad. Earlier, I worked in other institutions. Presently, this is my place. Today we will be talking about the issue of heart failure in India. See, before we talk about any problem, we have to know the extent of the problem. Unfortunately, in India, we cannot have accurate assessment of the disease burden. But based on the available information collected from various sources, we can easily say 1 to 2% of the population may be suffering from, I'm telling you, may be suffering from heart failure. Heart failure may be of various causes, but in general, we are talking about the clinical syndrome of heart failure. When we are talking about the heart failure, we obviously look at the causes of heart failure, So obviously, those are the people who develop heart failure in future. That means we call them as risk factors. People with all the cardiovascular risk factors which lead to future cardiovascular problems can ultimately result in heart failure. We can divide them into multiple things, structural and electrical. If there are structural issues with the valves, such as any valvular problems, mitral valve, aortic valve, either stenosis or regurgitation, then myocardial issues like after a heart attack, that is myocardial infarction, or any myocarditis, that is viral infection of the heart muscle, and certain cardiomyopathies, or diseases like diabetes and other diseases, endomyocardial fibrosis. Such things, cardiomyopathies, that is involvement of the heart muscle, can lead to future heart failure. Now coming to the electrical disturbances, if there are abnormal rhythm issues, faster rhythms especially, they can, if left untreated, they would develop heart failure in future. Also, there are some diseases, metabolic disorders, in addition to diabetes. There are some diseases which are such as thyroid disease can also, or vitamin deficiencies can also lead to heart failure in future. See, whenever there is a heart failure, first it has to be recognized. How do patients recognize it? Patients would have breathlessness, patients would have swelling of the feet, patients may feel fatigue, inability to move, and even in advanced cases, drowsiness. So when they go to hospital or a cardiologist with these symptoms, then the cardiologist will do the necessary investigations, and such as ECG, 2D echocardiogram, chest X-ray, all these things. So the 2D echocardiogram, the two-dimensional echocardiogram with Doppler examination, this gives the accurate information about the cause of the heart failure and the extent of the heart failure. We measure something called left ventricular ejection fraction. That is defined as the amount of blood ejected by the cardiac muscle during each cardiac beat is called as left ventricular ejection fraction. Once the diagnosis is made, then we treat. In the treatment, the earlier treatment is rest and salt and water restriction in diet, and then medications, starting from diuretics, that means to make a person lose water in urine, and then nitrates, then inotropes, we used to call them, some inotropes. Then the other treatment was vasodilator treatment. It started about 2 decades ago, wherein the arterial and venous dilators were used, and with these vasodilator treatment, it used to give a phenomenal improvement in the symptom status, and their prognosis also used to improve a lot. And some agents actually improved even mortality rates. Now, coming to the newer modalities, of late we have some newer drugs which are useful. One is ivabradine, it is called as the F channel blocker. It is useful in improving the mortality rates. And then there is another group called as valsartan and sacubitril combination, neprilysin inhibitors we call it as. It's a combination of angiotensin receptor blocker inhibition coupled with neprilysin inhibitor. These are called as sacubitril. These ones are known to improve the symptom status, improve the mortality rates, and decrease the recurrent hospitalizations because of acute decompensations. So these are called, these are the newer medicines available in terms of medical management. My message to the people who are living with heart failure, that means they have already developed heart failure. So there is nothing much we can talk about prevention. But it's a good idea to recapitulate all the good heart healthy lifestyle modalities which we can practice. Everybody, even after developing the disease, that is, we have to be active physically, we have to control all the risk factors such as stop smoking, reduce weight, regular exercise, control the risk factors such as diabetes, hypertension, cholesterol, thyroid disease, such things. If these risk factors are controlled, then we will not be getting into heart failure issues. But if you have already developed heart failure issues, my advice to you is don't lose hope. We have many modalities, exceptionally good medical management available, especially with the newer drugs such as ARB and neprilysin inhibitors, the sacubitril. With these medicines, we can improve your lifestyle. And even after controlling, there is also a chance of device treatment, that is cardiac resynchronization therapy. That means which is something like a pacemaker which can regulate your synchronicity of the heart muscle and improve the pumping function. And also, if need be, at the end, a heart transplant. So don't lose hope. Follow the instructions given by the doctors. Take regular medications, especially the newer ones, which are better, more efficacious, less side effects, and improve the long-term results. And then, if need be, further device therapies can be done. This is, and control, even when heart failure is controlled, at the same time, focus on controlling the risk factors as well. Thank you. Well, I can help all of you who come to me as patients, or before you become patients, I educate people about controlling the risk factors, the cardiovascular risk factors, whether it is major or minor. And then if you have developed heart failure, I can help you in excellent medical management, followed by device therapy or even transplant. But of course, prevention is better than cure. It is better to prevent heart failure than to go to the stage of treatment. I wish you all the best.